For decades, we've been told, cut out saturated fat to protect your heart. But a brand new meta-analysis just proved, after following over 13,000 people, it doesn't actually lower heart attack risk or save lives. So, is the real problem fat or something else? Hey everyone, my name is Marc Bates. I'm a metabolic health coach. This is one of my research reviews. Does cutting saturated fat really protect your heart? Keto and Carnivore Truth. Okay, so this is the paper we're talking about. It's from the Journal of American Medical Association Journal, 2025. And it's a systematic review and meta-analysis of randomized control trials testing whether reducing dietary saturated fat prevents cardiovascular disease, CVD events, or death across 9 RCTs, 9 different studies, with a total of 13,532 people in those studies. Bottom line here, we'll cut right to the chase for everybody. Saturated fat reduction did not significantly lower cardiovascular or all-cause mortality, myocardial infarction, or coronary events, i.e. it didn't help. Okay, stroke effects were unclear, and that we've seen. So most trials enrolled patients with established cardiovascular disease, which is important to understand. Okay, and very few included women. So only one trial involves statin users, right? So that just sets the guideline here. We're going to look at this study with the critical eye. We're going to tell you what's good and what's bad with it, and tell you, how we see it. Okay, so a method snapshot here. So this is a meta-analysis of multiple RCTs. So we included RCTs that restricted saturated fat, frequently replacing that saturated fat with unsaturated fats or other macronutrients, i.e. diet substitution trials. Okay, so this was not a saturated fat trial. This was a diet substitution trials. The outcomes, hard clinical endpoints, cardiovascular disease events or mortality rather than just cholesterol changes. So, we were looking for really good hard data here. The strengths in this particular review, this paper, was it focused on RCTs and hard outcomes, which means we're looking for hard data, right? So this reduces the number of confounding common or observational nutritional data that other types of studies would have, and it was very transparent sourcing. And there were supplementary material in the study that talked about what the studies were, what the strategies were, and they had lots of tables that you could go through if you wanted to. So it was a very good RCT review. Remember though, the problem you're going to have when you're doing a review of other studies is that any errors in those other studies are going to be baked into your review of it, and it doesn't get rid of some of the biases from the other ones, right? So meta reviews have good points and bad points. Okay, some limitations of the studies reviewed, right? The studies were older trials with older care standards. In other words, we had to deal with what the data was there. So most of the trials predate modern secondary prevention standards, whether it's statins or blood pressure targets or GLP-1, SGLT2 use. So the incremental benefit of saturated fat restriction on top of current care is unknown. Okay, and the authors do note that. Replacement nutrient heterogeneity. Some trials replace SFA with polyunsaturated fats, PUFAs, others with carbohydrates or mixed patterns, so the effects can diverge. PUFA replacement often fares better than carbohydrate replacement, but once again, lumping these all together can dilute the signal, so that's the limitation. The population was skewed to secondary prevention in men. So remember, Primarily, we're dealing with men who've already had a cardiovascular disease issue. So we're already dealing with a sick population for the most part. And it did pretty much exclude women. So, and this happens a lot with these studies. So there are differences between men and women in how these things go. And because these were older styles, dietary adherence and exposure measurement were imperfect. Okay? So you always have that issue. How this fits in with the wider literature, right? There's other pieces of literature that were referenced here. A literature review is pretty typical in a formal study. A Cochrane review from 2019 and 2020, updated in 2020, found, once again, approximately 17 to 21% relative risk reduction in combined cardiovascular events when reducing SFAs. Now, here's the key point, and I kind of agree with this stuff. These people, for the most part, all had cardiovascular disease already, which means that they had already had their first heart attack. And if you look at the statistics, if you're a man over 50 and you've already had a heart attack, that's where statistically statins and getting rid and reducing your saturated fat seem to have some effects. Otherwise, it just really doesn't, right? These were observational cohorts, right? So total fat and SFA often show no positive association with cardiovascular disease, which is the big problem with observational cohorts. You can't prove causation, okay? And so these do challenge the blanket SFA restriction, but once again, they're observational, so you're not going to get hard ones. And this is from a Lancet study. And then additionally, guidelines and position statements and this is from the American Heart Association and such, still recommend limiting saturated fat. And these studies really weren't because they were older, weren't going to go against the American Heart Association reviews. Okay, so bottom line, the evidence was that mortality benefit from saturated fat restriction remains unproven, right? Composite replacing saturated fats with PUFAs seemed to have some effect, but once again, remember, we're talking about men over 50 for the most part who already had a heart attack, right? That's the prime group for getting statins and having some effect and limiting saturated fats with the statins. Otherwise, it really doesn't matter. And that's statistical. I still have personal problems with that, but statistically, that's the one small group that it does seem to work in. And it's observational data only. So we always keep going back to the fact that it's observational data. There is no causation here that we can prove with any of this. Okay, so from a keto carnivore standpoint, right? Metabolic risk profile typically improves on ketogenic carnivore patterns, which they didn't look for. They didn't test this, obviously. Insulin-resistant individuals, triglycerides fall, HDL rises, weight and glycemia improve, LDL-C responses vary. In long-term low-carb interventions for type 2 diabetes, you can look at the VERTA, the CCI studies. For example, non-HDL did not worsen over 2 years, while multiple risk factors improved. Okay, so these improvements in metabolic syndrome components are major cardiovascular drivers, right? And you can find that in multiple studies. So they really weren't looking at the way to improve this. They were just looking at one thing, which is reducing saturated fat. Okay, they were looking for a overall heterogeneous LDL response, right? And the problem with that is that we now know that there's a minority of people who are called lean hyperresponders who can experience, especially if they go on a keto or carnivore diet, a marked increase in their LDL without any risk of additional cardiovascular disease. And I'm actually in that group. My doctor was freaking out on my LDL scores. And I told her, don't worry about it. Because anyone over 50 who did not have a cardiovascular disease, higher LDL actually, statistically, is healthier for you. And she had a hard time with that, but that's okay. She's learning a lot from me. And then there's the whole idea of looking at the mechanistic lens. Keto carnivore often reduces hepatic triglyceride production, improves insulin signaling, shifts LDL particle distribution. That's a big one. She didn't think about looking at LDL part. She was looking at LDL, just the raw number. She wasn't looking at the particle size differences, and definitely did not look at ApoB particle number and stuff like that, which really doesn't statistically show you a whole lot. But there are a lot of cardiologists who still like the ApoB numbers, right? Uh, and so, in looking at all these things, if they had put in this review some ketogenic and or uh, carnivore studies, it would have thrown their numbers wide off, but they would have seen then we had a mechanistic reason for benefits of this dietary approach versus just reducing saturated fat. Okay. So, some practical guidance for people who are thinking about keto or carnivore or currently on a keto carnivore diet. Keep the metabolic wins, right? Keto and carnivore give you big metabolic wins. Okay, prioritize carbohydrate restriction to normalize your glycemia, insulinemia. Emphasize whole food animal sources, ruminant meats, eggs, and seafood. If LDL-C and ApoB remain modest, continue current pattern. Focus on nutrient density and satiety. If your LDL-C and ApoB rise substantially, you might be lean mass hyperresponders, right? So, you might want to look at this. Shift some energy from saturated fats to MUFAs, right? Fattier fish, leaner ruminant cuts. But, once again, I would say, myself, I'm not a doctor. This is not a prescription. Give the ketogenic carnivore some time, at least 12 weeks, before you start thinking about shifting away from the saturated fats. Because if the LDL is going up, but your particle sizes are going down, right? So that they're going in the good direction, and all the other markers are going in the right direction, talk to your doctor. I don't think that's anything to worry about. You might want to consider doing a slightly lower total fat or energy diet. Once again, give the keto carnivore a chance first. Before you do that, talk with your doctor and do monitor. Probably maybe at least quarterly. Do at least the 3 and 6 month and maybe even a 9-month ApoB, LDL, LDLC, non-HDLC type blood tests. Do the whole range there. Look at your highly reactive CRP, right? And your A1C and your fasting insulin and your liver enzymes, right? Because the thing you're looking for is, are all of your metabolic markers going in the right direction? If they are, don't stop. That's good, okay? And definitely 100% avoid all ultra-processed carbs, industrial seed oils, especially anything that potentially is oxidized, which means an industrial seed oil that's in a bottle that's sitting in your pantry. It's oxidized, okay? As soon as you open it up, it starts to oxidize, right? Instead of using plant oils for substitution, go after either whole food fats like tallow, right, or butter, or you might consider some of the nut oils. I like macadamia oil, works very well, very light taste, a very good fat profile. So you might look at that as an option. Okay. Now, just to be fair, let's talk about some alternative viewpoints, right? On the con side, mortality benefit was not demonstrated with reducing your saturated fats. So the effects essentially hinged on what replaced the saturated fats and the quality of PUFA sources. And you're talking about things like refined seed oils or marine oils or olive oil. They're rarely good replacements, okay, quite honestly, okay? But people will say that that's good. Um, Another viewpoint is look at the total saturated fat isn't the main problem, right? Okay, so you want to consider reducing your refined carbs and getting your insulin resistance care, which is what I would suggest. Right, there are alternative viewpoints here. So the pros here, uh, once again, low carb trials demonstrate better that you get better glycemia, uh, triglycerides, HDL, weight. These are all key cardiovascular disease drivers. The cons, some individuals, once again, and I'm one of them, uh, when they go to a ketogenic or carnivore diet, their LDL goes up. But don't allow just a single LDL number to drive you back into the normal range yet. Look at what those numbers are. Ask for the particle sizes. Ask for comparing it against your other metabolic markers, and look at your metabolic markers over time. Because if all your metabolic numbers are moving in the right direction, your HDL is going up, your triglycerides are going down. If your LDL is going up, guess what? LDL, for the most part, is actually healthy for you. Your immune system runs off of your LDL, right? As long as it's not the bad inflamed LDL particles, it's usually a very good thing. Okay, so the suggestion: talk with your doctor here. Get on a carnivore ketogenic diet if you're not already on one. Stick on it for a while. Give it time. Watch your metabolic markers, and if they're going in the right direction, don't change, because everything else will come into play very quickly with that. All right? Bottom line here. Cutting saturated fat does not protect your heart. There is no evidence that suggests that that works, but what does help, or what we do seem to have good evidence for, is that a keto or carnivore diet improves all of your metabolic markers, which means that will ultimately have some improvement on you. And if you have cardiovascular disease, or you're on the verge of having cardiovascular disease, let's get to the root cause and let's fix that. And let's not jump right into doing pharmaceuticals necessarily that you may not need. Work very closely with your doctor on this. All right? Okay, everyone. Thanks for watching. If you have any comments or questions, leave them in the appropriate section. As always, do work with your doctor on all this stuff, especially if you're being told that you are high risk for cardiovascular disease. Keep them in the loop on everything you're doing. If you have something you want me to work on, or you have some ideas you need, add that in here. We are a community. I want to give you the answers you need, and just keep that going. And as always, if you haven't done so, please like this video, subscribe to the channel, share this with a friend who might need it. It helps the channel a great deal. You'll be helping some others, and I do appreciate it. Have a great day, everyone.